I'm here today to explain a little bit about some of the vaccines that you're going to be offered during your pregnancy. If you're pregnant right now, we're approaching winter season, and it's really important to give your little one the very best possible start that it can have. So, 3 vaccines to think about in pregnancy. The first one is the flu vaccine. That's aimed mainly at you. It's mainly designed to protect you because actually getting flu is horrible at the best of times. But getting flu when you're heavily pregnant can be really quite dangerous. So we want you to be protected. But actually, a really nice benefit of giving mums vaccines is that the antibodies they produce will float across the placenta and the baby will benefit as well. And it will be born with some of that immunity already on board. Now, this isn't a weird process. This is a natural process. We have come into contact with all sorts of lurgies and so forth, and we produce antibodies all the time as part of our body's defense system. And your baby's going to get a little variety of all of your antibodies. So we're just adding one extra one in there, and that is antibodies to protect against flu. So the flu vaccine is available all through the season. Flu is a very seasonal disease, but you're entitled to a flu vaccine every pregnancy and every time we have a flu season. So some ladies could even squeeze in 2 flu vaccines in one pregnancy sometimes. That's flu. That's all through pregnancy. Doesn't matter if you're in early pregnancy or just about to give birth, you're eligible right now. The other vaccines to think about, the next one is pertussis. Sounds old-fashioned, and its other name is whooping cough, which also sounds old-fashioned. But actually, sadly, we've had babies dying of whooping cough recently. Even this year, one baby has died of whooping cough. It's a really nasty respiratory infection caused by a bacteria that invades the lungs, causes lots of toxic damage to the lungs, and makes it very, very hard for babies to breathe. And it causes that horrible cough that you might have heard about, where people cough and cough and cough and cough until they breathe back in with a whooping noise. And that's where it got its name from. It's really dramatic and really scary, particularly in tiny little babies. So we desperately want all little babies to have some protection against whooping cough. Once your baby reaches 8 weeks of age, you will be invited to go to your GP surgery and get your baby's own jabs done. But in those first 8 weeks of life, the only way of protecting your baby against whooping cough is for you to have the vaccine in pregnancy. So from 16 weeks of pregnancy, right the way through, even until after pregnancy, actually, in those first 8 weeks of baby's life, you're eligible that whole time. You can have it any time, but it works better if you have it somewhere in the middle of your pregnancy. 20 weeks is a perfect time. And a lot of mums will get the pertussis whooping cough vaccine when they go and visit the midwife for their detailed scan at 20 weeks to one of the hospital antenatal clinics. But if you've missed that opportunity, ask your GP. So as I say, you can get it any time later on in pregnancy, just not in the first trimester, really. So that's the whooping cough vaccine. There's one more to think about. So currently 3 vaccines offered in pregnancy. And the final one is the RSV vaccine. RSV stands for respiratory syncytial virus. Terrible mouthful, which is why we call it RSV. The RSV has been around for donkey's years, and you've probably heard of it in terms of you've heard about babies getting bronchiolitis or babies getting, slightly older children maybe getting croup, having a croupy cough. Those are terms to cover some symptoms which are very often caused by RSV. So bronchiolitis is what we're talking about. Now, tiny babies, again, they really struggle with this nasty respiratory virus. Every year, somewhere between 20 and 30 babies will die because of RSV infection. And it's avoidable, potentially, by you having a vaccine. The vaccine hasn't been around for years and years, but it has been around for a couple of years, and it's got a really good safety record. And also now we're seeing brilliant results. So actually what we're finding is that the mums who have had that vaccine in pregnancy are far less likely, more than 70% less likely to have a baby admitted to hospital with RSV bronchiolitis. So it's really doing an amazing job. This vaccine is one that we recommend for the later stage, the last trimester of pregnancy. So you'll find you're invited for it from 28 weeks. Ideally, you'd have it done before about 32 weeks, but you could have it as late as 36 weeks or even the tail end of pregnancy. But a bit of time is a good idea because remember, we want your immune system to process this vaccine, to have a good antibody response, and for those antibodies to float across the placenta to your baby. And that process takes a good couple of weeks or so. So you don't want to leave it till the very last minute and not allow enough time for that process to happen. So those are the 3 vaccines. It is complicated because they are all different stages of your pregnancy that you're invited to have them. But by the time you give birth, we want you to have had all three of them. And that's for every pregnancy. You'll be invited again for them next time you get pregnant. If you need any other advice or information, please speak with your midwife. She should be able to answer all your questions on this, or ask your vaccinator at the hospital, or make an appointment at your GP surgery and speak to the practice nurse who can also give you these vaccines. And also consider having a look on our website. It's full of information about the vaccines that you're offered in pregnancy.